So welcome to EuroPCR 2021. My name is Joost Dam and I'm an interventional cardiologist at the Erasmus University Medical Center in Rotterdam, the Netherlands. So in the recent years, there's been a lot of focus on post-PCI FFR since it's proved to predict outcome. Yet it's still infrequently used because of the fact that the assessment of post-PCI FFR can be cumbersome because of the lack of dedicated technologies and the need to reuse adenosine, which takes time. Still, there is little data on how to improve a post-PCI FFR, or whether you have not to use a pullback, to use imaging, use specific gradients, and what is the exact threshold that needs to be used in order to optimize post-PCI FFR. Finally, there's limited data as to whether the additional optimization following a low post-PCI FFR actually improves patient outcome. The FFR-React trial was designed to investigate whether IVUS-guided optimization in patients with a post-PCI FFR below 0.90 would improve patient outcome as determined by 1-year target vessel failure rates. So between October 2017 and April 2020, a total of 620 patients were enrolled who underwent successful post-PCI FFR assessment. Of those, a total of 291 patients had a post-PCI FFR below 0.90 and were subsequently randomized to either IVUS-guided optimization, an arm that finally enrolled 145 patients, versus a conservative arm which finally enrolled 146 patients. All remaining patients were followed in a prospective registry. In those who underwent optimization, post-PCI FFR significantly improved post-optimization. So the key feature of the FFR-React trial was that we used HD IVUS to assess the potential intraluminal residual pathologies in patients with a post-PCI FFR below 0.90. So the IVUS allowed us to really find the causes of low post-PCI FFR, which was demonstrated by the presence of residual lesions in 30% of the cases. Despite an angiographically successful PCI, we were able to identify the amount of underexpansion or malposition and the presence of diffuse disease, which helped us to actually tailor the post-procedural optimization strategy per patient based on the HD IVUS. So by using IVUS to assess post-PCI results, we were able to optimize the procedure in 80% of the cases by adding either additional stents in 30% of the cases or doing additional optimization of the previously implanted stent in 1 out of 3 patients. So in the FFR-React trial, we optimized 100 patients and we found only one optimization-related complication, which consisted of a minor dissection that was resolved with a additional stent. With that, we concluded that post-PCI optimization was a very safe maneuver if directed by IVUS. So as presented during the recent ACC meeting just a week ago, we focused on the potential of post-PCI optimization in the IVUS arm of the FFR-React trial. The next steps will be that we finalized enrollment in April 2020, which means that we're currently finalizing the 1-year follow-up of the FFR-React trial and will there be able to address the primary endpoint of the trial, which consists of a potential superiority of the IVUS-guided optimization in patients with the post-PCI FFR below 90 as compared to a standard conservative treatment strategy. Thank you for watching to this short 5-minute interview. We look forward to presenting to you the 1-year results of the FFR-React trial shortly.